thank you all for coming to our session. Apparently licensing, legal, and land use is fascinating, and it's not so much with youth prevention, but we have a great panel for you all to hear from today, and just a really important topic when it comes to marijuana legalization, regulation, and enforcement. So we have a great panel, and hopefully you'll learn a lot of stuff, and feel free to ask some questions. So in Denver, the Denver residents make up about 12% of the state, yet we have about 37% of recreational marijuana business licenses here in Denver. So because we have that high concentration, we really feel like our youth here in Denver have a greater exposure to it, and may, for that reason, may just have different perceptions and different behaviors when it comes to marijuana. So we've really taken a hands-on, proactive approach to prevention and education, and you're going to hear from a lot of great people today that have their hands really deep in that work and through those efforts. Going back to 2014, when retail marijuana first happened in Denver, we really kind of sat down with a lot of stakeholders and took a look at education and the different efforts, the different possibilities, what we thought we might be able to do to approach this. And we came up with just kind of a multi-pronged approach to address this kind of from a couple of different directions. So this is kind of summarizing the different efforts that Denver has around marijuana education. We have a big effort around youth prevention. So kind of the three tracks that I see are prevention, diversion, and then just some general education. So for the youth, we really try to focus on the age group that you'll hear about today on the prevention side. And then we go into a little bit of diversion. So we look at those youth, those older youth that are already headed down that path, already using marijuana or some other substance, and trying to come up with some programs and activities to really divert them away from that type of activity until the age is appropriate. And then we have some general population awareness about the laws, the rules around marijuana, safety, public consumer safety issues. And then we utilize the state's campaigns a lot. So Allie Maffey from the state is here, and she'll be telling you a lot about the great campaigns for youth that the state has developed. And then data collection. So you heard a lot about data collection if you went to the Measuring the Impact session. But we also, Catherine DeYoung, who was on that panel, spoke about the public health impacts. And really the work that Denver Health is doing for us, we're utilizing that information to inform future education campaigns. So that public impact data really is going to hopefully turn into some education campaigns later on down the road. So I come from the Denver Budget Office, which is what I was doing before marijuana came into my life. And then so I think about everything in terms of dollars. So if I want to hear a story about how Denver's done this, for me, I just think about it in dollars. So that's how I've put it up here for you. And so I didn't go all the way back to 2014, but in 2016, you can see the breakdown of how we allocated marijuana-related expenditures across the city. And this is we'll go into a lot more detail in one of the sessions, the next sessions, but you can see that in 2016, 31% of the $9 or so million dedicated to marijuana-related expenditures went to education, and in 2017, that's increasing to 36%. So it's a good amount. It's a priority for the mayor, and it's a priority for our office. You can kind of see the breakdown then on the right side of the slide about where all those dollars are going. That's in hundreds, so Parks and Rec gets $99,000, not $908. Just fit better on the slide. And then Denver Health, and the program that goes on in Parks and Rec is called Night Moves, and that's some programming activities that happen in the rec centers, on the weekend, evening hours to keep the kids active and busy during those times. The Denver Health is really that data collection piece. And then we have some funds going to Office of Marijuana Policy, which we're going to be starting a marketing campaign, a youth education marketing campaign. That is really just getting started. So hopefully a year from now at the next symposium, we'll have a lot of great lessons learned from that campaign or stories to tell about it. So stay tuned for that. And then the behavioral health and the children's affairs. You'll hear from both those agencies today. And those are two agencies within the city of Denver where we've really utilized the collaborative model that you've heard about a lot at this symposium. So we took some existing programs and some existing grant programs in the city and leveraged their expertise and their connections with the community to develop some grant programs. So both those offices just do a request for proposals and distribute grant dollars to different types of activities. The Office of Behavioral Health does more of that diversion track that I was talking about, and the Children's Affairs Office does more of that prevention track that I was talking about. And that's in the Children's Affairs, dollars on the prevention side and the marketing campaign is where we're really increasing our effort in 2017. This is just a quick little glimpse. I don't know if you saw the Know the Law card sitting out at any of the tables, but this is more of our general education, public awareness, know the law type stuff for more of the adult education. And then we have our Parks and Rec signs just to educate people about that you still can't smoke in the parks. So now I'll go into just a little bit about after school, why we put some funds into the after school programming and the Office of Children's Affairs, and then I'll hand it over to the people that are really the experts and are really delivering these programs. So, like I said, back in 2014, when we looked about how to approach education for marijuana, we took this multi-pronged approach, and when we talked about prevention, we really heard a lot of great research about how valuable and effective after-school programming is. And so for every $1 invested in an after-school program, it saves $9 for reducing crime, improving kids' performance, and increasing the youth earning potential. So we really looked at this area as something that was underserved in Denver. There's a big gap in the number of providers for after-school programming. So, and that being just a time of risk, a high time of risk, the after-school time, and then the summertime when kids aren't in the classroom, just provides an opportunity for them to kind of, get creative with what they do. So what we said is let's utilize that time, get them doing pro-social activities. So that's why we focus some dollars in that area. And this is, we try to then spread that opportunity throughout the city of Denver, but Denver does have some high priority neighborhoods. So the Office of Children's Affairs had some existing grant programs, and they had some priority neighborhoods based on a number of different criteria, such as, percentage with free and reduced lunch, and just a number of different criteria. But then we also laid on top of that the concentration or saturation neighborhoods with marijuana businesses. So the dark blue neighborhoods you'll see are our neighborhoods that have both that priority neighborhood for the Office of Children's Affairs and a high number of marijuana facilities. And then the little yellow bubbles are where we've distributed those grant dollars, and the larger the bubble, the larger the investment. So we try to spread that across the city as much as possible. And I think that's all, and I'll pass it off now. We're going to hear from the Office of Children's Affairs, the people that distribute or run the dollars for the the pro-social activities after school time, and then we'll hear from behavioral health as well as the state.
Hi all, my name is Lauren Brown. I am the manager of out-of-school time programs at the Mi Casa Resource Center. And our agency does a lot of work in the community. We work with adults in career and business, but specifically the work that I do is working at our middle school location, and we coordinate those pro-social activities that Molly was talking about. And I want to talk now about kind of why healthy lifestyles and how does healthy lifestyles fit into the things that we already do. So as we are implementing prevention work, we're looking for lots of different approaches because we want to hit the kids as many times as possible with the facts. And so we see here kind of that previous DARE era prevention programs that we know don't work. Scare tactics, war on drugs, this is your brain on drugs. We know those things don't work because they don't align up with where adolescents and young people are at developmentally. So we're moving really, and Healthy Lifestyles is helping us do that, in addition to lots of other things that we do at the neighborhood center, moving to fact-driven, right? We're not trying to get kids to believe a certain set of values, but we're doing activities that help them cultivate their own personal identity, and looking at processing evidence. We know that the brain is developing until the students are 25. We're with them from 6th grade, 7th grade, and 8th grade. And so we're really seizing on that opportunity. We know that their peers, are the most important kind of thing in their life. So we're working on cultivating their group identity, right? Affirming their autonomy, affirming their agency. And so it's really moving from an adult-oriented view to a youth-centered view. And then it's not those ATOD choices in a vacuum, right? It's not just don't smoke because it's bad, but really upping their social emotional skills, being strengths-based in our approach in order to then talk about the facts about marijuana specifically. As we look at kind of what that formula for impact is, we want students, our goal is that students make healthy choices around marijuana. And to do that, they need to have that integrated identity. They need to know who they are, and they need to have the right facts. If they don't have the right facts, they might not make a choice that is congruent with their identity. So it's those things working in tandem. They need to know the health effects. They need to know the legal effects. And I think the biggest amount of work that we do with 6th through 8th graders is a ton of myth busting. I feel like they come to us and they have all of these misconceptions or misinformation about what is marijuana, how does marijuana work, how do you get marijuana, who can use it. I've had students tell me that the legal age for smoking is like as young as 12 all the way to you can't use it until you're over 50. And so, I mean, just this broad range of like, where did you get that information? How do you think that? And so I think for us, it's a lot of myth busting. As we look at the program components, healthy lifestyles, marijuana is just one part of it. It's not like this 40-session curriculum on marijuana. Marijuana is one component where we talk about decision making, where we talk about self-image and self-efficacy, where we talk about healthy relationships, where we talk about goal setting. And again, building up all of those pro-social supports and making sure that they have a good understanding of who they are in order to make choices about marijuana. And like I said, I think a huge part of what we do is busting myths. And these are just some of the myths that we have heard. Marijuana can't hurt me because it's a natural medicine. They know it comes from a plant, and we talk about healthy food and eating our greens. Marijuana is natural. Pot grows your brain. I know my brain's developing. Pot's gonna help it grow. Marijuana isn't that bad. It helps you stay calm. I've heard a lot of kids say, yeah, you're a better driver when you're high. Helps you stay focused. And so a lot of what we're doing is providing those facts in a non-judgmental way. Just saying, this is what we know. These are the facts about the situation. And then you in the future are gonna make a choice for yourself about marijuana. I think two things that I want to share. One, I want to share a story that I think illustrates how important it is for students to have those loving, caring, supportive adults that they can go to. And I think it also illustrates how they need to have the facts. This happened about 1.5 years ago. We had students in the after-school program, a group of like 4 girls, knew a friend of theirs was smoking marijuana. They were super stressed out. They were worried. They had been sending him texts and doing everything in their power to get him to stop, and he was continuing to use on a daily basis. And they were at our program. They were at Mi Casa after school, and he had a pipe and marijuana in his backpack. And he had it in a cubby. We have like student cubbies where they can put their stuff. And they got in his backpack, took the weed, took the pipe, ran outside, dumped all of the weed in the gutter, and then came in and handed me this plastic bag with a pipe and an empty like medicine bottle. And I was like, what do I do with this? Thank you. And I think that shows that they were really concerned for their friend. They wanted to help. they were pretty shocked when I said, I'm so sorry, I have to turn this into the school, and it might result in your friend getting a ticket for paraphernalia. I think that they were like, in the back room sobbing that their friend was going to get in trouble, which was what they were trying to avoid. But I think for them, they knew that it was a problem and they wanted to help. The last thing is, this happened yesterday afternoon at our neighborhood center. We've been teaching the Healthy Lifestyles curriculum, and yesterday had a smaller group of students, and so we gave them a social media challenge. And we said, it's up to you to create a public awareness campaign that you can teach your peers about marijuana and the facts that you've learned. And so they got really into makeameme.org. So they made many, many memes in about 30 minutes yesterday. And I just wanted to show some of them to you because I think it shows how we need to be relevant when we message to youth, but we also need to let them own the messaging. So this is the Gene Wilder, Willy Wonka. You use marijuana before school? Tell me your current grades. Why you smoke marijuana? Your brain's still developing. When people say everybody smokes marijuana. So taking those facts and making them relevant for themselves. That's all for me. I look forward to questions later.
Hi, everyone. My name is Daniel Reed, and I work with Denver Public Schools. Together with our after-school community, we really wanted to see, well, we know we have this formula for impact. We know that this knowledge and these SEL skills are really important, but we really wanted to assess what happens in these summer programs. So together with our after-school programs, I developed about a 20-item questionnaire to really get at what students are knowing before and after this program. Now, this is really important that it's pre and post, and we recognize our limitations, longevity of retention, the fact that only 119 students have data for this out of about 500. But this is kind of our first indication of something really, really cool. Unlike a lot of other surveys that are out there for students and youth that are about what they perceive about marijuana or about their usage data, which I think Allie's going to talk to in a few minutes, this is really about their knowledge around the consequences and legal framework of marijuana. And I think this is going to be really exciting data for all of you, because you might be surprised what youth know, perceive, and don't know about the state of the legal framework here in Colorado. And these have tremendous consequences for their actions. So let me go through this really quick. First of all, as Lauren said at the very beginning, we're really focused in Healthy Lifestyles on making sure that students aren't just making this marijuana decision in a vacuum. In fact, most of the curriculum, about 5 out of 6 lessons, really focused on these social emotional skills. Now, you might have called this character education in the past, values education. Really, it's part of a trajectory of saying we want youth to have a strong integrated identity that allows them to make decisions that are consistent with that identity. The common phrase that you might have heard before is that internal compass. What drives them from within to make decisions, be it marijuana, be it the decision to do their homework at night, be it any decision? What's driving them from within? So a lot of the course curriculum really had to do with what's your role in decision making? What's your sense of agency? What helps you make decisions from within, be it a logical decision or an intuitive decision? Those are the two kinds of decisions that we work on with youth. And finally, the integrated identity. That sense that there's something within you that helps make decisions for you. These are really illustrative data that are common amongst the 20 items that we surveyed youth on. Now, these aren't the kind of content specific to marijuana, which I'm going to get to in just the next slide, but these are around youth saying, yeah, after the curriculum, after Healthy Lifestyles, I did learn a little bit about my ability to make decisions for myself, my role in goal setting, my role in my future orientation. And these are all tremendously powerful skills to have, real competencies to have when you're tasked with that decision. Am I going to use marijuana because my friends are? These are competencies that youth can rely on. Let me dig into a few different parts of this competency-based education survey that we had. And please, just as a side, I've just rolled out the report, so if you want the full report, please contact me. I have a number of copies for you. But here's just a little bit of a teaser. These were a few questions around knowledge that we wanted youth to have. So this idea that marijuana use can lead to lower grades in school, we found that about 3/4 of students believed that at the beginning, about 9 in 10 at the end. Eating an edible can be just as dangerous as smoking marijuana. This was really important to youth when we surveyed them after year 1 of the survey, which was summer 2015. We found that they were still pretty confused about what an edible was, its potency, and we know that a lot has changed in terms of edibles potency, but we still wanted to make sure that youth were knowing that this is a product that has real potency to it. Lauren also spoke to myths and misconceptions, and this is a really important point that I want to stick on for just a moment. When you don't have knowledge and someone tells you something, it's really easy to start believing it because you don't have a pre-existing knowledge. When you've already got a myth or a misconception, that means that someone's given you data or you have a reason to believe that something is true, even though it may not be. And this was really important because you actually have to dispel a myth, which is actually pretty complicated stuff to do with youth because they have good reasons to believe a myth, misconception, or something that's not totally accurate. So these are 3 of the 4 questions that we identified early on that youth were believing, as Lauren pointed out, that we really wanted to address in a strong way. Marijuana is a medicine that I can use whenever I'm sick. Marijuana affects kids and adults in the same way, and it's natural and harmless, and so it's okay for me to use. We saw pretty decent growth on these items, but it's still concerning that, for example, about 1 in 2 youth still believe that it affects adults and kids in the same way. And so we think that that's something that we really, as a society, as our policymakers, really need to address, is why are youth believing this and where are they getting that information from? And again, Allie's gonna have some great information on that as well, I think. Finally, this was the #1 question that our stakeholders and our youth really wanted to focus in on. What's the legal age to use marijuana? As you can see, before the program, about 1 in 2 students did not believe that the legal age was 21. That's a concern. It's definitely a concern. Now, I don't want to say this is representative of the Denver youth population. In fact, in this sample that I'm showing you, 9 in 10 kids were non-white, 9 in 10 kids were free or reduced lunch, and 1 out of 2 of the students were English language learners. So it's not a representative sample. I want to make that extraordinarily clear. Nonetheless, even after going through the curriculum, where we stressed many times what the legal age was, about 2 in 10 students couldn't identify it as being 21. I want everybody to kind of pause on that for a second and maybe think about how that reflects on your own work or what questions that might raise for you. Finally, if you're thinking about taking on a curriculum that really addresses the youth where they are and can really help them think about their role in making decisions, I want to give you 4 quick recommendations. 1, your after-school providers are a powerful asset in your community. Every community has an after-school network that you can tap into. They're trusted adults. As Lauren's kind of anecdote illustrated, trusted adults are where kids are getting information, and that method of transmission of information is totally non-trivial. Consider this. Stick to the facts that youth want. They're really hungry. Be a driver in the conversation with youth. There are lots of great tools. Allie is going to show us in a bit. She's going to show you some great tools that they've developed and also that we've developed to really think about how you can be a driver in that conversation. Consider it. Youth are coming into our programs with a lot of myths and misconceptions. Where are they getting those? They're getting them from their friends. They're getting them from TV. If they're not accurate, youth are liable to make decisions that they wouldn't otherwise make. Really important. Social emotional learning, again, character education, value education, whatever you call it. These are those internal competencies that when youth are faced with that tough decision, I'm gonna use marijuana because my friends are, even though I know it's wrong, they have skills to say, you know what? This isn't what I wanna do because it's gonna get in my way of being a track star. It's gonna get in the way of me going to college. These are too important to me. Guys, I'm not gonna do it. Finally, connect with the other protective resources. We need to be really valuing that kids can't be getting different information from trusted adults. We really think that it's important that we're all messaging something very similar that says you're an agent in your own life, please make a positive decision. So with that in mind, those are our 4 recommendations. I'm here for questions and I have a full report with lots of juicy nuggets. Thanks, guys.
Good afternoon. So you have to put up my voice. I've been sick, so hopefully you can hear it, and hopefully it will last for all of us. I'm Regina Herder with the Office of Behavioral Health Strategies, and Ed Charlson from my office and I are going to talk with you a little bit about what we're doing around the diversion funds. So when Molly first came to us and said, we want you guys to really think about an RFP and a process to look at diversion funds, not prevention, but diversion funds, what would that look like? And so we went, we've gone into 2 different processes now. The very first one we call Yo Bud. Now you guys got to have some humor around this, like Yo Bud, right? Yeah. So it's Youth Opportunity Behavioral Health Diversion Program. And those applications went out a year ago, and we've had 6 agencies that Ed will talk about that are actually running those particular funds. But there we started specifically looking at trying to mitigate consequences, kind of what Lauren was talking about, that, you know, you got kids trying to do the right thing and then somebody might get a ticket, and what do you do about that? So the funds were really put out to try to say, how do we help intervene from a law enforcement perspective and also from a school's perspective so that we can reduce suspensions and expulsions, but we can also really then get the people to treatment and education as they should be given. And then also be able to try to help build out some of those aftercare or after school hours and different kinds of opportunities for kids who are already thinking that this stuff is okay to be using and have in their life. And a lot of kids where they're coming from family systems where there is also exposure. The more recent marijuana funds, diversion funds that we just released are the Marijuana Accountability Solutions Project funds. And that was purposely to not just look at kids in a school or a criminal justice perspective, but to look at the bigger part of diversion and understanding the implications around marijuana, around places. So we have a lot of kids who think it's okay kids and adults who think it's okay to smoke outside. And that's not something they can do. We have a lot of DUIDs, so driving under the influence of drug. So we're seeing impacts around driving and marijuana related. So that could be an area around diversion funds to try to tackle that particular group. And then looking at group and one-on-one interventions. So we're looking at diversion funds right now in kind of 2 major kinds of areas. One is specific to schools and specific to trying to help mitigate while holding people accountable in that little younger age range. And then those accountability solution funds for a little older population, that kind of 16 to 21-year-old, and what we can do there to try to help mitigate some of the impacts and help give people the right kind of services and treatment. So we are that particular part of it, not the prevention, but really looking at how do we help divert and how do we help get people access to the right kinds of services. I'm going to bring Ed up here, and it's Ed's birthday, so if you guys wanted to, you could say happy birthday to him. But yay, I know, huh? So Ed just joined my office just a few weeks ago and has done a great job in helping to take on managing these particular programs. So Ed?
Thank you, Reggie. Kind of. So we're going to talk about the data we've collected to this point with Yo Bud funds. But first, we thought it's important to keep in mind some data that's been put out by the Substance Abuse and Mental Health Services Administration. So they surveyed over 65,000 people across the country, age 12 and older, who are considered to be in good mental health. So this first slide is perception of risk of smoking marijuana once per month. So how do people view smoking once per month in terms of risk? And as you can see, the blue bar here is United States, yellow Colorado, and DMA stands for the Denver metro area, which is represented in red. So you can see there's kind of a gradual decline in the perception of risk of using once per month across the country. The next slide shows us at the same time, the same source of data, that past month marijuana use, so people reporting that they've used at least once in the last month, that there's a slow, gradual increase in that reporting. So just some things to keep in mind in terms of Colorado, the US, and the Denver metro, is they all seem to be following similar patterns. Colorado may be a bit exaggerated in these numbers. So we'll now move into the programs that YoBud contracted with. So starting earlier this year, between January 1st and April 1st, these contractors each rolled out their programs and began to work with youth all around the city. School-based programming, we have the S Institute, which focuses on leadership, emotional intelligence, and mentoring programs. Their real passion is teaching teens to be mentors, positive mentors to other teens. The Boys and Girls Club, they are providing alternative suspension and expulsion programming for kids who are being identified in the school system or who are already been expelled, to get them back on track and back into school. Those are our school-based programming. Community-based / alternative. So the Office of Independent Monitor is running a program that I personally think is one of the best kind of programs to be running at the moment. The focus of their programming is to bring police officers and youth together in a 5-hour session where the kids are educated on what their actual rights are versus what their perceived rights are when interacting with the police. And there's also some rapport building there. The kids get to tell their story, the police officers get to tell their story to the kids, and they come out knowing a bit more about each other and feeling a little bit different about each other, which at this time I think is really important. So that's a 5-hour session where the officers are taught about child development, where are the kids at when they're interacting with them, making sure that they understand that. It's one of my favorite programs we're working with at the moment. Youth on Record also, a community-based program who engages kids in music and the arts. One of the areas we struggle to provide services in is trying to reach kids who are interested in arts and music. So their program, they partner with a lot of local agencies to get referrals for kids. And part of their programming is kids can actually go into a recording studio and record music. But in order to do that, they have to drop clean UAs. So to get to that part of the program, they have to be clean to get into the studio. And the studio, by my understanding, is impressive. I think $2 million studio is what I was told. So the kids are quite eager to get in there. So that's the Youth on Record program. And the other programs, the Colorado Nonprofit Development Center Strengthening Families program. So mainly in the Montbello area in the city of Denver, this program is working with families and children in the home. So part of the session is a treatment provider with the parents, teaching them basically how to strengthen their parenting skills. And then part of the session is with the youth, really teaching them how to manage themselves, peer pressure, goal setting, managing stress. And then the latter part of the session is bringing the whole family together and really working on improving the functioning of that family. And then in Justice, we have the HYPE program run by the Denver Public Safety Youth Programs. This is basically set up as a day treatment program for kids who are not currently in school, and some after-school programming where they can do some credit recovery type services. And some family advocacy groups, they also do some trauma-informed care as well as substance abuse and victim empathy programs. Those are the programs that have been running, that we've been funding in some part since the early part of the year. Many of them have been in operation for years prior to. So we have just begun to collect data from these programs. And so it's very preliminary data. Again, we've just been running since the beginning of the year. We have a pretty small sample size. So we thought it'd be good to reflect what are they providing, who are they providing it to. So the first thing, what they're providing, there's a lot of training going on. So the blue here is core services, the primary service of an organization. The yellow is a secondary service if they have one. So there's a lot of staff facilitator, mentor training going on as we're training folks all over the city to start operating many of these programs. That's a primary service. as well as classes in education and a small percentage of treatment. We'd like to see that increase, and hopefully as these programs continue to develop, we'll see that increase. Secondary programming, mentoring tops the list there with some activities, and then some programs just don't really have a secondary service at this time. So that's basically what they're providing. So this is a reflection of the population we're working with at the moment. So you see a large Hispanic, Latino population that we're working with. That doesn't really reflect the city data. City data is more around 30% Hispanic, yet they're represented by 63% in our programs, mainly attributed to the neighborhoods we're working in. The contractors that made proposals to work with us, they work where they work, and we aim to cover more of the city as we move on. So the Hispanics are Hispanic population, possibly overrepresented here, as that's actually a 30% number in the city. The African American population as well is represented by 14% here, but is actually around 10% in the city. And the white population, which is represented as 8% here, is 53% of the Denver area. So our programs are just hitting certain neighborhoods at the moment. We hope to cover more of the city as we move forward. So just some demo information here on the average, like the grades reported and the age reported for each student. I think we have an anomaly here, as someone who is 29 is apparently participating in one of the programs. It's not really who we're going for, but we'll provide service, right? So the 10th and 11th graders, who are mainly 15 and 16, is who we're working with. Maybe you look at the 13 and 14-year-olds, and maybe that's alarming, the numbers of kids we're working with in that age range in our programming. So the last few questions were directly asking the kids, do you use, how often do you use? So this represents basically about 47% of the respondents noted that they're using at least once a month, 25% daily, which is pretty concerning. For the sample size, again, next year we'll probably have a lot more data, a lot larger sample set, but this is what we're seeing so far. And our last slide is we kind of asked the question and said, tell us everything that's relevant to you. Tell us why you're using exactly, and tell us all the different reasons. So 83% are saying they like using marijuana. 71%, I think it's fun. 59%, my friends use it. And then some ones that you could maybe deduct some things from. It's something to do. 59% saying it's something to do, and it helps me feel better. You may come to some conclusions as to maybe what is behind some of those numbers there. I have a red medical card, 16%. And my family members use it, 21%. So plenty to dig into there with us. We're going to continue to modify how we're asking questions to try to really dig down with the people we're working with to try to get the best data so we can really drive our service delivery based on what we're collecting. That is it for me.
Awesome. You got mine to flow from there. The formatting of our slides are sometimes crazy. So as I said, I'm Allie Maffey. I'm the Retail Marijuana Education Program Manager with the state, and so hopefully I'll provide just some of the resources and context that really actually reinforce everything that they've been sharing about their work locally here in Denver. So diving in just to the public health roles, we have a group that focuses on data and trends, identifying the health effects, patterns of use, and health impacts. And then we use that information as part of our retail marijuana education program. The main thing to reinforce here, and I said this yesterday and I'll say it until I'm blue in the face, is everyone needs that top group that you can rely on to really have a firm grounding and understanding in what the data is telling you is happening in your state, as well as what will you say the health effects are. You've heard them reference, the fact that the brain is still developing until age 25. What are the consequences for underage use? Is it different? Does it impact youth differently than it impacts adults? And so having that science of what you will stand on and say are the health effects of marijuana, because you can find something that tells you any direction of the health impacts of marijuana, and so to really have something solid. So getting a little bit more into what those health effects are, our Retail Marijuana Public Health Advisory Committee reviews all the health research related to these topics. For the 2014 report, they've added a couple more topics in the 2016 report that will be available in January. Those updated chapters are already available online. If you Google retail marijuana at the State Health Department, you should be able to find those topics. So looking at the effects of youth, all the research is divided into substantial, moderate, limited, insufficient, and mixed. But this is all association only, not causation. Causation requires randomized controlled trials, and as I'm sure you can guess, there's a lot of ethical and legal issues with doing randomized controlled trials, particularly on youth, and particularly related to marijuana. So we don't have causal impact, but we do have research on association. And so looking, there are some substantial health effects, and the one caveat to keep in mind with even the substantial health effects related to marijuana use is that there may be a mitigating factor in there. So for instance, the top one, less high school graduation. We do know that youth who are suspended are less likely to graduate high school. And so is marijuana associated with lower rates of graduation because of that interim suspension, since kids who use are more likely to be suspended, and then kids who are suspended are more likely to not graduate? Or is it actually associated with only the marijuana use? And so there are some mitigating factors like that where, yes, there's substantial evidence that they both rise together, but is something else flowing the water in that makes those two boats rise at the same time. So just always something to keep in mind. So the public health statements that they then generated from that research are the following. One, regular marijuana use by adolescents and young adults is associated with impaired learning, memory, math, and reading achievement even 28 days after last use, and that effect gets worse the more marijuana that they use. This was the one health effect. When we did focus groups with more than 350 youth around the state, focus groups, in-school visits, phone calls, a bunch of different things. We did friendship groups actually so that the youth didn't posture in a focus group of new peers. We did friendship groups because they're more likely to be honest in those scenarios. And when we did those focus groups, this was the one thing they agreed with. They called pretty much everything else propaganda, but this they agreed with. Because they knew someone who didn't perform as well, didn't do as well, didn't ace the test, didn't try out for the team as well as they wanted to, and that those impacts lasted for some time even after they last used. There is a strong association with psychotic symptoms. Again, this is one of those, is that because of self-medication of youth who have mental health issues? Are they self-medicating with marijuana, or is marijuana contributing to those symptoms? We don't know. It's developed, again, number 3 is the same, psychotic disorders. Number 4, marijuana use by adolescents and young adults, even occasional use, is associated with future high-risk use. A lot of people say, oh, so this reinforces the gateway drug theory. And no, that is not true. What this says is that youth who take risks go on to take other risks. And so particularly when those risks as an adolescent go unrewarded and not punished, if they experience only positive reinforcement. Going back to the slide you just presented, where you had high numbers, 3 out of 4 students saying things like, I like it, it's fun, my friends do it. And that's something else I read. But anyway, they're feeling the reward of use and not the consequence of use immediately. And so kids who take risks and feel rewards will go on to take more risks. And that's what this reinforces. Yep, 2 more here. Some marijuana users become addicted. Again, this is true for any substance. The earlier someone begins to use it, the more likely they are to develop an addiction to that substance later on. And treatment is effective. We wanted to make sure that was included. Oh, sorry, you were taking, well, the slides will be available afterwards, I promise. I want to make sure I save time for questions, so I know I'm going through these a little bit quickly. So we do have the Healthy Kids Colorado survey, which is a unified survey between the Department of Education, Human Services, and Public Health that includes the Youth Risk Behavior Survey, which is the national survey. And this data was presented yesterday, so I won't spend a lot of time on it. I do have some handouts on this data if people are interested. You can also go to healthykidscolo.org, which is like Colorado just for short, C-O-L-O, healthykidscolo.org. But the marijuana use in high schools, you can see that this includes confidence intervals, that we have not seen statistically significant changes over the last 10 years. But we're about in line with national average for ever use as well as for current use. We do know that multiracial youth are much more likely to use than multiracial and minority youth are much more likely to use than Caucasian, except for the Asian population. And we do know that use is higher among youth that identify as bisexual, gay or lesbian, or transgender. This is information about the rates of use in a regional breakdown. We have 21 health statistics regions in the state in order to be able to group data from different counties that are very rural or frontier. And so you can see Denver is its own region just because the population here allows it to reach statistical significance at that level. So Denver is Denver as well as Pueblo, Southwest Colorado, and then the I-70 corridor there. Are higher levels of use across the state, and that's past 30-day use. And then this really reinforces some of what both Molly and Lauren shared about the focuses on middle schoolers, is we do know that 91% first tried after age 13. That drops to about only, I think it's 45% when you look at age 15, I believe. I have to do the math in my head, but something like that. So within the next 2 years is when age of first use goes up significantly. And so reaching them prior to age 13, definitely prior to the transition from middle to high school, is incredibly important. And then this was one area of concern for us that we did see in the Healthy Kids Colorado survey this past time. We saw a statistically significant drop in perception of risk. And as we know, with alcohol and tobacco, when perception of risk goes down, use follows by going up. And the interesting caveat that I think we all are still trying to learn is when 25 states have legalized marijuana as a medicine, it only makes sense that perceptions of risk are going down. 25 states, half of this country's states believe that it's medicinal. So it makes sense it's going down. Will we see the same change in use as we do with alcohol and tobacco related to perceptions? We don't know yet. But it's definitely something that we're monitoring. Marijuana is the second most used substance this is ever use. Alcohol still by far exceeds marijuana. We did add e-devices, like e-cigarettes, to the last 30-day use, and that use rate was higher in the last 30 days for e-cigarettes than for marijuana. And so that's something that we're also working closely with our tobacco program on. And then this is the really cool part. So that's the worry. Here's the hope. That youth who agree that teachers care and encourage them are nearly twice as likely not to use marijuana. Youth who say that they can talk to a parent or guardian for help are about 1.5 times less likely to use. Youth who have clear family rules at home, nearly twice as likely not to use. And then this one, if a parent feels like it is wrong for someone to use underage, that youth is 4 times less likely to use. So this is an incredible opportunity for intervention. I see people taking pictures and I'm about to move on. I'm sorry. I promise I'll email you, I promise. And so with this information for the statewide youth prevention campaigns, and I referenced this yesterday, I talked a little bit more about the Trusted Adult campaign than about the youth campaign. And again, I said this yesterday and I'll say it again, we don't always get to pick if we're the trusted adults. I like to turn the phrase around and say adults who youth trust, because I may think I'm a trustworthy adult, but I'm not if a teenager actually isn't confiding in me. I might think I'm cool and I really might not be. So it's just a caveat for us all to think about, to make sure it's the right person delivering the message, because they do listen to the adults that they trust. And so we want to make sure we're equipping the right adults with the information then. So our youth prevention through a social marketing campaign effort was really a two-sided approach, the youth-centric side as well as the trusted adult side. So I'll spend a little bit of time talking about the youth-centric campaign, which, as you'll see, the word emotional is written on that side versus rational on the trusted adult side. The youth really rejected health messaging as part of a social marketing campaign. Norming, sure, consequences, maybe, but aspirational, yes, that's what they wanted. They all knew other teens who maybe hadn't achieved what they wanted to because of marijuana in their lives. And so they wanted, and I believe it was Daniel who said that marijuana can get in the way of. And that's actually the tagline of our campaign. Don't let marijuana get in the way of. And so the campaign is called Protect What's Next. And each kid has a different of what? Of sports, of theater, of music, of building trust with their parents so they can drive the car and be able to have more freedom, of their relationship with their younger siblings and being a role model. So every teen has a different reason, but they understood not letting marijuana get in the way of that thing that they're trying to achieve. So what we focused on is building a platform that was authentic and relatable between youth, because where they trust the rational information was coming from the adults. So we focused the content-heavy part on the adult campaign. And then the youth is much more aspirational, as I said. So we'll see if this one works. I didn't embed yesterday. We'll see if it works today. Nope. So we're going to skip that. That's why I don't try and embed ads, because I have not yet successfully made it happen in presentations. So anyway, that's the Trusted Adult campaign. And we have those additional information for parents. Them saying no starts with you saying something. Get tips, facts for talking to youth about marijuana on our website. So that's the Trusted Adult side. But the youth side, really, as I said, their number one deterrent was that it could get in the way of achieving their goals, and short-term goals, not long-term goals. When I first presented this, someone was like, but their brains aren't fully developed to have long-term goals yet. I'm like, no, I agree. And don't say long-term goals, because the last, 4 presidents have admitted to marijuana use, and they were presidents. Michael Phelps was caught using marijuana, so don't focus on long-term goals. That didn't resonate with them. It's the short-term things that they wanted to achieve. And then up in the upper right-hand corner, that's how we present the tagline that I said out loud. You can see we used a pot leaf, and that was intentional because they have different terminology. And again, I'm not cool enough to stay up on the terminology youth are using about marijuana all the time, so we used a pot leaf. When you go to the website, the campaign really does work to help unite kids with those goals. So discover something worth protecting. The overall campaign being called Protect What's Next. So what is next for them? Help find something. So they can look at adulting, health, creativity. And if they clicked on adulting, they might find life skills that interest you, like connecting with a career, academics, developing their social life, managing money. And then on the right-hand side, pick the activities that interest you. On mobile, this is mobile enhanced, and so it's like Tinder. They swipe left and right when it's on their mobile devices. So if they want to focus on finding their first job or creating their first application. And then to complement this, we did this youth outreach toolkit, and Mi Casa Resource Center, where Lauren works, was so gracious to help pilot this program. We did 4 youth groups across the state. And it was this idea of a peer-to-peer-led activity. So this does not take the place of evidence-based health education curricula. We didn't intend this to be an adult activity with youth, but more of a peer-to-peer relationship with youth. And one of our youth advisors went and facilitated this with other teens, where they would talk to kids about their bucket list. What are they hoping to achieve in the next 2 years? And then start the conversation about what might get in the way for them. And they would actually elicit questions about marijuana from the youth, and they'd snowball them, throw them at each other, and then try and answer them. Lesson learned, we used our youth advisor, who was a bit more aware of marijuana issues because he worked in our branch, in our division. And what we found is most youth are not prepared to answer those questions. He had a lot more exposure. And so though this is a peer-to-peer youth toolkit, it's actually available for order on our Trusted Adult website, because an adult is going to have to help an adolescent be able to prepare to do this with other adolescents. This is like a great youth group activity, peer-led, but because there are some tough conversations about marijuana that come up, it really needs that trusted adult intervention with the peer who's leading it to be able to do this. And I copied this slide from a previous presentation, so it did launch this past summer. And then other work that's happening across the state. So there's a really great breakdown of how all of the state marijuana money and tax dollars are being divided, and it's very similar to what Molly showed at the beginning. The 4 priorities for the state breakdown are youth prevention, substance abuse treatment, public safety, and then regulation and oversight are the 4 priorities. And so this is just kind of an example of the money's going to all these different state agencies for all of these different priorities. And so the ones that are relevant to youth prevention include CDE, the Department of Education, the upper left-hand side. They receive school health professional grant money, as well as a couple $1 million for bullying prevention programs. Straight up at Human Services, now Human Services also gets a lot of money for substance abuse prevention, but they do receive a few $1 million for Tony Gramscis Youth Services, which funds a lot of after-school programs, as they were referencing. CDOT with a Drive High, Get a DUI campaign. Similar, we do see in our Healthy Kids Colorado survey more willingness to either drive or ride in the car with someone after they were using marijuana than after they were using alcohol. So the impaired driving messages have been more effective with youth around alcohol, and we need to step that up with marijuana as well. And then on the left-hand side, I mean, we can't do any of our youth prevention work without a well-regulated system that is preventing youth access at point of sale and enforcing some of the laws that were purposely adapted here in the state. And I won't go into those in depth, but just know that the state applied a lot of lessons learned from alcohol and from tobacco already in that regulatory system. And so we need that happening as well. And then from the state health department side, the surveillance and data and education. So some of the direct youth services that are being funded through this work, evidence-based health education curricula. So the CDE has the funding for the FTE in schools, and then a lot of other programs are trying to complement that funding with giving them the access to the resources and education curricula that they need to implement those curricula in schools. The bullying prevention grants, marijuana-free school resources. So marijuana was added to the tobacco-free schools law in the state. And so working with schools to make sure that they're updating their policies and communicating with their partners appropriately about that information. The funding for mentoring and after-school programs like through TGYS, and then treatment dollars. We do have a few other resources related to healthcare providers. What we found was that through a survey we did about 400 healthcare providers in the state, what clinical guidance were they missing? The top 3 things were talking to youth, talking to parents, and talking to pregnant and breastfeeding women. So we developed clinical guidelines for each of those. The next one was dosing for medical marijuana was what they wanted, and I'm not going there. So definitely not enough research for that yet. So we do have pediatric exposure prevention clinical guidance for healthcare providers that speak directly to adolescents, as well as for healthcare providers that are working with parent and guardians. So with that, it's question time. And I think there are, thank you all. There are 2 microphones to ask questions.
This one on? Hey, I'm Jacob. I'm a park ranger supervisor, works for Denver Parks and Recreation. So my question is centered around our park system. Our team pretty much sees what goes on in parks every single day throughout the city. And for those who aren't familiar with Denver's system, we have about 250 parks in the urban area. So because we have so many parks, they line up with a lot of schools that are out there. And what we see is on lunch breaks and after schools, we get a lot of kids that go out there on a regular basis to use various drugs. So my question to you guys is, do you have any outreach programs that address that kind of behavior? like going out and speaking with those groups and kind of going out to public places where they will use and will smoke weed in the parks, for instance?
So we do not, we don't have anyone right now that's actually going out to do that. However, I would always encourage all the departments to look at the RFPs when they come out, because in fact, the RFP that we just released on the marijuana accountability would have been a perfect RFP to go after to kind of build in that kind of a service. So there's always opportunities, and maybe you and I and Ed can follow up afterwards. And let's talk about what you've got, and there's probably some of the agencies that we're working with that actually could come out and help do some of that work.
And I would just add on to that too, that Denver Public Schools, continues to be a great connection and a great relationship that we need to continue to cultivate and talk about these types of conversations with. And they actually did apply for the most recent Accountability Solutions Project funds. So, that's, we can include that in the conversations we have with them as we build out a potential proposal and grant program with them.
Good afternoon. I had two questions, one for Ed. On your Youth on Board, you said that they tested the kids prior to going to that the music program.
Yeah.
When you said they tested them, are you like actually drug testing them before they do it, or is it just kind of like an honesty policy?
Actually, I'm not exactly sure who's doing it. I believe they have to drop a clean UA.
Okay.
But that's in collaboration with Youth on Record. I'm not sure that they're doing it
Okay.
themselves.
And then the other one was for Ali, and there was a bulleted point up there where parents who think underage use is wrong, and the kids were 4 times less likely. But what about parents who think underage use is wrong but responsible use is okay? Is there any data on that? Because that's a huge difference.
That is a huge difference. Great question. So I would say the way the question is worded, because it's kind of a summary of the full question, but the question is about underage use being wrong. So it doesn't infer, it's only applying to underage use, which would be illegal, and not to responsible use as adults. So that's a really great question, and not something we have more information about. Yes. So what happens when you turn 21? Yep.
Hello, my name is Santiago. I'm a professor down at Colorado College. So some of the stats you showed are really interesting in terms of minority communities, because it seems like you're showing stats that fly in the face of national trends, which is that minority groups use at the same rates, if not in some cases just slightly lower in the cases of Latinos, and just like 1 percentage point higher in the cases of African Americans. So are you noticing if this is a sampling problem, or if this is something unique to Colorado that would actually sort of really go against the type of programming you're trying to offer? Because if it has nothing to do with any sorts of social circumstances in the home, if it has something to do more with social issues around racism, classism, the way we've been talking about, the way the saturation of marijuana businesses are in these communities, how do you fix that using some sort of assets that you now have available to you that really would go against what's necessary as part of this education?
That's a great question. So I'll start answering it and then see if I'm on track for what you're looking for. So in our adult behavior risk factor surveillance system, which is kind of the adult healthy kids, it's a randomized phone survey. We actually find that Latino adults use at a lower rate than the general population. Mm-hmm. But then Healthy Kids is finding that Latino youth use at a higher rate than the general population. And that disconnect, and that is weighted data to the populations within the state, so it's not a sampling issue. So our concern really is that disconnect between the adult use and the youth use that is so much higher. And so we've done some pretty concentrated Spanish language outreach within the state. And I kind of mentioned this yesterday, but we found really different attitudes towards marijuana, and as did CDOT, from the Spanish-speaking population to the English-speaking population. As far as approachability was the highest value in English versus in Spanish. They wanted more authoritarian, like this is a serious issue, take it seriously, and communicate that way. So our Spanish language campaign does look very different, and the tagline is an informed community is a safer community. And so really, because there was a little bit like, well, we don't need to know about that, we use lower rate, but knowing that the youth use at a higher rate was our concern about educating adults in those communities.
Well, and I guess my point is has more to do with, what's happening with youth that they feel alienated. I mean, so
Yes,
I teach at a premier liberal arts college where we see the same thing with young adults, where white students, we have the Michael Phelps, the George W. Bush, the Bill Clinton syndrome, where most of these kids, having used since they were the age of 13, have led very successful careers, right?
Yeah.
So in some ways, right, white youth have assets that allow for them to engage in the type of success efforts, right? Whether that's multi-prescription use like Adderall, Vyvanse, these sort of study drugs that allow them to perform much better. So I think it's a matter not just of educational resources, but right,
Yes.
capital, both cultural and material, that can't really be addressed through a type of campaign like this, right?
Yep. And then the coping concerns of particularly like LGBTQ youth that we saw with much higher use rates as well. Of, when we did our focus groups, the number one reasons we heard as to why they used was pressure. There's so much pressure on them, and the difficulty coping. And so particularly when you think about youth with identity, gender identity, and other issues, or being a minority in the community, that was definitely something that came up.
Yeah, and that explains your multiracial youth being the highest sort of
Exactly.
rate. So are there efforts to try to combat that through other systems aside from, flyers and things like that? Is there like
Great
a mayor's
question.
office?
So social marketing campaigns can only do so much. They're not an effective and evidence-based prevention program on their own, for sure. So it has to be coupled with other evidence-based programs at the community level. And so we have just started funding for Communities That Care at the statewide level. We've been partnering with our substance abuse prevention programs that have community-level funding out in communities, as well as the Tony Gramscis Youth Services, which is doing all the after-school programs and things like that, and does serve a lot of those populations of youth. But I totally agree, it's not effective in and of itself. And then also putting this in context of time, because I have 2 new staff and we've been talking kind of like where the campaigns are going next. And knowing that we're creating a system from nothing, so like creating like general education and then getting more and more specific over time. And so it's something we hope to do more through the campaign moving forward, for sure.
Thank you.
Hi, I'm Lindsay Grotto from Public Health Seattle and King County. This is so exciting to see this really well-rounded program. And my question is sort of the sad side of, if you were to give give advice to another large metropolitan area but has a tiny little fraction of the money that Denver has, what would you think are the most important elements that we should use?
Can I jump in, please? In early August, I was lucky enough to go to a conference in Chicago called Every Hour Counts, all for out-of-school time providers, and I met some incredible out-of-school time providers in King County. So I would say just like Daniel said, find your out-of-school time providers, because they are there in Seattle, and they are amazing, and they're working really hard to make a great difference in kids' lives. So I would say, use that network that already exists, that's already strong, that's committed to seeing kids make healthy choices in all areas of your life, because I think you're going to have success finding those established providers. So I would say, and I don't remember their name, but I can look it up and I can give it to you. So yeah.
In addition to that,
all of our different providers right now in the first round of our funding with the YoBud funding have really taken what they were doing and then added, and I think this was also part of the slide, Lauren, that you had showed, where it's like marijuana doesn't have to be all this. It's a part of those kind of different risk factors, risky behaviors. And so they've all developed then a curriculum component that specifically addresses marijuana. And I think that that's also really important. So to be able to create the alternatives, but also to be able to take, you don't have to start all over, you don't have to reinvent the wheel, but how do you take what's already good work that's going on and then really build it out in a way that really specifically targets this particular kind of issue?
Any other questions from anybody? Well, you have one more second to decide while I do a couple of housekeeping things, just to remind you, if anybody has to catch a flight or scoot out early, and this is your last session, we do have one more. I think it's financial impacts and building and fire are the two that are going on next. You may have already received it, and if not, we'll be sending out an email with a survey today, so please fill out a survey and let us know where we can improve and what else you'd like to hear and what you thought of the symposium. We will be sharing contact information with everybody that attended the symposium or had registered with the symposium, so you'll be able to network through that way. And then all the slides will be online, hopefully early next week, as well as the videos of each presentation will eventually be online as well. And as always, we have are available for contact, questions, putting you in touch with the right resource. As you can tell in Denver, we've got, in Seattle, Oregon, all the places that have spoken, we've got a lot of great contacts and networks that we can utilize. So reach out to us if you need to get in touch with anybody or anything. So thank you.
Thanks.